Welcome to the Counselling Tutor Podcast, the must-listen-to podcast for students of counselling and psychotherapy. Here are your hosts, Rory Lees-Oakes and Ken Kelly.
Hello and welcome to the Counselling Tutor Podcast with me, Rory Lees-Oakes, and with me, as always, my fellow partner in everything therapeutic, Mr. Ken Kelly. How are you, Ken?
Exceptionally well, Rory. Mindful that we're on episode 97 episodes of Counselling Tutor Podcast, approaching the centenary, the 100th episode, in which we will do something really special. And if you're listening in real time, that will happen early in January, mid-January 2019. So something to look out for. But lots to look out for today as well, because episode 97, we're going to be starting off by looking at how we can manage the anxiety that comes up. And we're talking specifically about the anxiety that is linked to being observed in your skill sessions. When you've got somebody watching you, even if that's just in a triad and you've got a peer watching you, but that anxiety can be even higher if you're being assessed and you've got an assessor observing your skills. In practice matters, own personal therapy. Wow, do we hear a lot of questions, some moans and whinges about this, Rory, some questions of why we have to have it. You're going to be diving in for us today.
I am, and I'm going to be talking about why having your own personal therapy is really important. And I'm also going to be talking about that very, very kind of gnarly question that gets asked and tutors get asked all the time. How come if someone can't really be sent for therapy, we're being sent for it? So I'm going to try and talk about that kind of juxtaposition where it's an expectation of students. Yet, we talk about in general terms therapy being something of choice. And I'm going to try and square that circle a little bit.
Such an interesting topic. There's the cost related to that, and it's really, I'm looking forward to today, Rory. I really am. And then we're going to be ending episode 97 looking at cultural dimensions, looking at who are you working with, what area are you working with, what are the cultural norms that exist in those areas, and what might be coming into your room, your practice room, and how you might work with that. I guess looking at your own cultural dimensions as well, Rory.
Yeah, absolutely. I think that we all come from a different cultural perspective, and we have to be very, very careful that we don't project our worldview onto clients. Clients come with their own frame of reference, and we work within that. And I'm going to be talking about just some observations through the practice life of how cultures are how sometimes we have completely different cultures and what we might have to think about.
Just reminds me of Boy George O'Dowd. I believe he started a culture club. Boom, boom. That's my joke for the day. Right, moving on. There'll be a load of people going, culture club? Who's that? Starting off, managing anxiety linked to observed skills. Rory, oh man.
Oh, I know. One of the things that certainly when we talk, Ken, was there was lots of times when as tutors we had to listen to people's skills. It usually starts in level 2, where we just get people to talk to the person next to them and start developing that listening, attending, and really kind of focusing in on someone and putting your own material to the back to get to develop that rich seam of listening and understanding. And as it goes through the courses, level 2, and then there's level 3, which is a little bit more formal, where it's recorded and learners have to make a tape. And then, of course, level 4, where it is, in fact, advanced counselling skills. So all through that, there's a lot of anxiety. And certainly at level 4, at practice level, we issue what's called a fitness to practice letter. And part of that is listening to either a recording or in real time of a learner using their skills. And sometimes it can be a real angst generating project where people get really stressed out. And I've had people literally run out of the room crying because they're that worked up about it. And I kind of really want to say that I kind of get why people get stressed out about it, but there are really good reasons to listen to people's skills. And one of them is to make sure they're working at the level that they should be in terms of passing the course. And, I also believe that there are some really useful ideas that people who are doing skills could take away. And one of them is we're kind of assessing skills, not judging the person, Ken.
Yeah. I get the anxiety as well. I really do. Counselling is such a personal thing. It is the client, it is you as the counsellor. Having a third person in the room listening to that, by the very nature of that person being there, it just feels invasive in the relationship, in the process, and it can bring up immense anxiety from yourself being the person being assessed on that. Am I good enough? Am I going to get this right? Will I meet the requirements? And you can find yourself being pulled out of being able to use your skills as you might if it was just you and a peer practicing. I hear so often from supervisees saying, it's great when I do my skills and I'm working with someone, I can do it. But as soon as the tutor is there moderating or observing that, then I kind of fall apart. And that anxiety is the stumbling block. It really is. So I have some ideas on this. Well, the first idea I have is a question. And the question is this: are you recording your simulated skills sessions with your peers? Are you doing it? Answer that honestly. Are you recording when you have a skills practice session? Are you saying to your peer, you know what, I want to record this so that I can listen back to my skills and I can kind of work on that? Because if you are, and if you introduce that and start recording just your practice skills sessions when you're given that time to practice, you become used to recording your skills, listening back to your skills, and that can really reduce the anxiety. Because if you're now having to record for assessment, hey, you've done it maybe 30, 40 times. So you are used to the recorder. You're not wondering, is the recorder working? Is it picking everything up? Am I doing it loud enough? You know, because you've recorded it time and time again. And I think that is a great way of reducing the anxiety. And there's an added bonus that if you start listening back to your skills, there is immense growth in that. As directed by Carl Rogers, he said it was the richest form of learning that they had, sitting around listening to recordings.
Absolutely, Ken. In fact, Rogers himself was one of the first therapists ever to use recordings. He spent a fortune in those days on big reel-to-reel recording devices because he was listening back to the quality of the listening and the interaction. And also, I think it's really important. Through the years, a lot of students have said to me, I really hate the sound of my own voice. And it's because we don't actually hear it as other people do. It's one of the peculiarities of being a human being, is that we think we know our own voice, but once it's recorded, it sounds completely different. Someone said to me, if you put two books in front of your ears, one either side of your head, you actually hear what you sound like, with people holding books up now, trying that experiment out. So get used to the sound of your own voice. And I think that's important, because people think, do I really sound like that? And also take it as a rare opportunity, because in training, it's probably going to be the only time, with few exceptions, that you're going to get someone who's really qualified, who will help guide you with your skills and your interactions. And this is about taking that opportunity. It may not be the most comfortable opportunity, but it will help develop that just essential skill set, because it's all in the interaction between you and the client. So take it as an opportunity to learn and build your skill sets up. And if it's facilitated properly by the tutor and it's embraced by the learning group, it can be just a font of super learning and personal development.
Indeed. I could not agree more. It's interesting you're speaking about how we hear our voices back on a recorder and go, oh, that's not me. And the reason for that is because of something, it's resonance, internal resonance. As we speak, our voice is resonating in our mouth, in our head, in our chest, and that's what we hear, because we're hearing our internal resonance in the same way as if you eat a crisp with your mouth closed. You can hear every crunch and bite of that, whereas people outside will probably not hear that, or they would hear it a lot lower. So we do hear ourselves differently. How you sound on tape, that's kind of how you sound, and that's it. And people have accepted you so far throughout your whole life. It's about getting over self, as is so much of counselling training. Oh, I don't like how I sound on tape. There's an area for some personal development and work there, because it is as it is. But yes, so important. I think one other anxiety busting tip that I have, and this is about calling it as it is. So much of the anxiety is around the pretending. We talk about counselling as there being congruence or genuineness in the relationship. But if you're pretending and working to an external criteria of I've got to get in my reflection, I've got to get in a paraphrase, I've got to open, I've got to close, all of that genuineness in the counselling can be lost in hitting the right markers. And a way of getting around that is to call it as it is from the very beginning. Be genuine right from the beginning in saying, so Rory, you and I are here now, and we've got a little bit of time where we're going to go over these skills. But I just want to acknowledge the fact that this is being recorded and it will be listened to by a tutor who is assessing my skills, and call it as it is, because it kind of makes it true. And then you can bring more of the genuineness in, as opposed to trying to pretend and feeling that discomfort of not having the congruence in the relationship.
Absolutely. And I think, and I'm going to call this out, I think it's not great for people to role play. So if you're working with somebody and they're playing a role, they're acting out something, I think that's really difficult, because unless you're working with a professional actor, what happens is they run out of backstory. So you can only go so far. I can remember a few years ago listening to someone being assessed, and the person who was doing the speaking, the person in the role of client, was making it up. And the person who was listening was really, really struggling. And the reason they were struggling was because what was being told them was so incongruent and quite clearly an acted role that it was virtually impossible for the person using the skills to get any sense of who the person was.
Yeah.
And it's a tough one for tutors, because tutors want to obviously keep protection, make sure people are protected. But I would say that certainly when myself and yourself talk, Ken, we would say just bring something from your own life. It doesn't have to be really deep stuff. Just bring something and talk about something from your life just to explore it. But yeah, I'd avoid making things up. The only time that I kind of say that's okay is I've taught counselling skills to very young people. And in those cases, we got them to use soap characters from soaps, because they felt very, very self-conscious. But in kind of mature adult training, try and bring something from yourself. It could be anything. Just your journey to work is good enough for someone to be able to practice their skills. But really do avoid role plays, because they just don't work in my experience.
100%. There's really good points coming out of this, and they really can reduce anxiety. So working with real material doesn't have to be deep and dark. It can be light. Many times in practice, a client will come in and say, actually, you know what, today I kind of feel all right, and may just bring superficial stuff. It is part of what we experience in practice. So not pretending, calling it as it is. Make sure that you're recording your skills beforehand, so you've got practice of that. Listen to yourself back. There's great learning in that, and being mindful in the moment when you are there with your person who is playing the client and you're playing the counsellor, to have no expectations of where they may go. Rory called it, when the assessors are listening back, when the moderators are listening back, they're listening to your use of skills. They're not listening to the material that the client brings, only in how you respond to that. And we, as counsellors, we don't need to have the client cry or go into a really dark place or take them somewhere that they wouldn't normally go. You can just reflect back, paraphrase, use silence, just use your basic skills, and you will be fine. Take lots of deep breaths and do it.
Yes, definitely. And even if you get kind of difficult news that you need to do some development, well, you're training. That's the whole thing. If you could do it, you possibly wouldn't need to do a course. So, take that learning opportunity. It's not personal. It is just that the tutor's trying to get the very best out of you in terms of your skills. So, keep at it. keep learning. And the thing is, it's consistent learning. No one, I don't think, who's competent ever stops learning.
Wow, what a topic. All the best if you have skills sessions coming up. I know it is that time of year where people may be being assessed for fitness to practice. And speaking about practice, we have a section called Practice Matters where we look at an element of practice. And today, Rory, you're going to be discussing your own personal therapy. Us as trainees needing to have our own personal therapy on top of all of our studies, on top of our learning, on top of our supervision. We need to go and have a number of sessions, and there's often controversy around that or questions of why that is, and you're going to kind of touch on that.
I am. I'm going to talk about why it's important that anybody who's doing a counselling or psychotherapy course has their own therapy, and I'm also going to be touching on the dangers of not having it, because there are distinct dangers for both you as a practitioner and, crucially, the client.
Let's get straight into Practice Matters after this short message.
Take the stress out of your counselling studies and get the support of Rory and I by joining us in the Counselling Study Resource. See how Counselling Study Resource can help you. Visit counsellingtutor.com. That's counsellingtutor.com.
Compulsory therapy in training, is it an oxymoron, a contradiction in terms? Through the years, I've been challenged by students who point out that after being told that no one should be sent for counselling, part of their course requirement is that they have to attend personal therapy. It feels like a massive contradiction and a bit hypocritical. However, training to be a counsellor is a unique experience and one that can have profound effects on the student's worldview. One cannot underestimate the emotional changes and shifts in perception which occur during training. As Irving Yalom reflects in his book, The Gift of Therapy, personal therapy is a tuning of the therapist's most valuable instrument, the therapist's own self. There are some other valid reasons why undertaking therapy during training may be beneficial, such as decreasing the stigma of counselling and mental health. By attending therapy, you are giving a clear signal. You are giving mental well-being the same priority as physical health, a strong message in a society that still tends to stigmatise poor or difficult mental health. It helps increase empathy. Being on the receiving end of counselling can make you acutely aware of how it feels when the going gets tough. It helps inform what interventions are helpful and which are not. It helps prevent harm to clients through self-care. Sometimes it takes another to help us identify when you're emotionally or mentally unwell. The process of understanding yourself through another's observation can shed light into your blind spots, areas outside of awareness. This understanding gain can help you assess if you are in the right emotional and mental place to work with clients. And building on that, preventing harm to clients through self-knowledge. One potential minefield is the phenomena known as transference and countertransference. When this happens in the therapy room, you are literally in a time machine, taken back to old feelings generated by another relationship or object. Attending therapy helps you develop an awareness of old patterns of behaviour. Should this become apparent in the therapeutic relationship, you can see it for what it is and take it to supervision. Without this insight, both you and the client may become entangled in your historical feelings. It also helps develop your internal supervisor. Part of attending therapy is to see how another therapy works and consider if in the same circumstances you would do the same. It's not unusual for therapists in training to identify interventions that they may or may not use themselves. It's a unique opportunity to experience ethical practice in action. In conclusion, while being sent for therapy may seem counter to the spirit of a freely entered relationship, you may be surprised at what you find out about yourself. Counselling training is a journey of self-discovery with personal therapy at the heart of this process.
Thank you as always, Rory. Rory's created a super duper handout that you're going to want to have. And that's all about why we need our own personal therapy, those important points that were covered. And you can download that for free by going to counsellingtutor.com. Click on the podcast tab. It's right in the top menu. Make your way to episode 97. That's today's episode. All the show notes are there. Any links we may have mentioned are there. And you can download Rory's super duper handout by just putting in your email address, and we will send that straight through to you. If, however, you are already a member of our paid-for resource called the Counselling Study resource, well then, that handout has already been added to your handouts vault. You can just log in. That is there and waiting for you. But moving away from practice onto cultural divisions.
Yes, it's an interesting one. And this came up in our Facebook page. And if you're not familiar with our Facebook page, if you go to Facebook, type in Counselling Tutor into the search bar, click it, you'll find our closed group. Knock on the door. We're super friendly. We let you in. And there's over 21,000 like-minded people. We have tutors, we have qualified colleagues, we have people in training across all different levels, and of course myself and Ken pop in occasionally just to say hi. So pop in there, and people put in such wonderful posts. And one post that came up was, what happens if you're working in an area that has a distinct culture? And I'm thinking maybe of former mining towns in the north of England, former steel towns, industrial towns, and thinking about how we work with clients who may come with a cultural view of the world that is generated by where they live. And I want to share a little bit of a story. When I was in training many years ago, I was talking to one of my peers who came, shall we say, from a nice leafy area in Cheshire. I don't want to kind of knock people who live in Cheshire. It's a lovely part of the world. I know Ken lives in Cheshire technically, but I think she hadn't quite lived the kind of life I had as someone who's brought up in inner city Manchester. And I was explaining some things from my history, and her eyebrows started to lift. And I swear that by the time I'd finished, her eyebrows were higher than her head. And I thought, oh my goodness, I'm not, she was a lovely woman, but I really wasn't comfortable talking about my experiences. And the reason is that she had a distinct frame of reference generated from her own experience of the world. And I think we have to be really, really careful. I talked a few weeks ago about free speech in the therapy room and allowing people to be able to say what they want. And sometimes those ideas may be completely different to our own. But that is the nature of working with clients. They're there to talk about what's going on for them. And sometimes we have to be thoughtful of the cultural context that we're counselling in. I counselled in Ashton-under-Lyne, just down the road from where I live. And, Ashton-under-Lyne is a distinct area with a distinct sense of community. And it's amazing how much community-related material, things like employment, things like the local housing situation, things like the local policing or the structure of the council came up in individual people's lives. I've worked with a lot of people who are claiming benefits or maybe claiming sickness benefit. And again, it was about working with their culture and understanding not just them, but their frame of reference, where they came from. Because it's just so easy to leave our fingerprints on clients. And I can remember somebody saying to me, because I have a double barrel name, and people sometimes mistake that for me being, I'm going to use the word posh. And Rory Lees-Oakes, it does sound a bit grand sometimes. And I remember someone saying to me once, "Can I ask you a question?" I said, "Of course." And he said, "Do you like opera?" And I'm like, "No, I don't like opera." And she said, "Oh," she said, "I thought you liked opera." And it was really, really interesting, because that conversation then allowed me to actually get a sense of what she thought our relationship. And as a consequence of that, the relationship became deeper. I said, "Actually, I like Oasis. I like a bit of a sing-along with Noel and Liam." And it really did change the direction of the relationship. It went deeper. It was more trusting. So culture, and especially if you're working in post-industrial areas, Certainly in the north of England and some places in the south where they've had rapid changes in their culture, driven by the work that was available, I think is useful. And it's the same if you're working in an area that has a different form of employment. I think it was Karl Marx who said that employment shapes our culture. It's like a football. So at the bottom was employment, the bottom half of the football was employment. The employment opportunity shapes the culture and also the societal values of how we live. So being very thoughtful of our own cultural heritage and the clients we work with.
It's an important topic, and I think we speak about equality and diversity and difference and embracing difference, but culture is a tricky one. It can almost slip in unseen. The person opposite me looks and feels the same as me, but there can be a cultural difference, a massive cultural difference. I remember, Rory, I was born in the UK, but our family immigrated to South Africa in the early 1970s, and I had most of my life in South Africa, which is a very different country with a very different culture. And I came back to the United Kingdom in my late 30s, and I was so surprised that you could get in your car and drive 15, 20 minutes and be surrounded by an entirely different culture, and then get in your car again and drive another 20 minutes and the culture is different again, and another 20 minutes and the culture is different again, town for town. And it was very apparent to me because I'd lived in South Africa. But you just need to look at football team support to see culture. People will wear certain clothes, chant certain songs, and have certain very firm beliefs depending on who they support. They can live next door to each other and have very different cultures. And we need to understand what our culture is. We need to understand the diverse rainbow that is culture and be sensitive, I guess, in working with that. Words and phrases that we might use can be totally inappropriate, culturally inappropriate.
Yeah, absolutely. And here in the UK, we do seem a bit obsessed with class. If you go to any kind of party, we're coming up to Christmas, just check out how often, if you meet someone new to you, the first thing they're likely to say is, what do you do? And what they're really saying is, are you like me? Do you have the same values?
Interesting.
And a few years ago, I went to a party, and I hate playing this game. And someone said to me, what do you do? And I said, I'm a cleaner. I clean toilets. And he went, I've just got to go to that person over there. Lovely to speak to you. And off they went. And about 5 minutes later, I was talking to someone else, and I said, I'm a counsellor and I lecture. And this person overheard it, and she came back and he said, I thought you said you cleaned toilets. I didn't realise you were a lecturer. And I said, I thought you said you had someone else to speak to. Yeah. And it was like, so now you want to speak to me because you perceive me as a better quality person. There's nothing wrong with cleaning toilets. It's honourable work. And I think in the UK, we still have kind of real class-based divisions, and I think it's useful to explore that. I certainly explored it in my own training, and indeed my own therapy.
It just comes up again and again and again, doesn't it? You're touching on own therapy from Practice Matters today, touching on personal development, exploration of self. This is so much of studying to become a counsellor, a psychotherapist, is looking at yourself. How does your culture contaminate, or how can it potentially contaminate a therapeutic relationship? Because you are who you are. You are you. And you bring with you your culture, and you bring that with you into your counselling room. So if you're not really looking at that and understanding it, it's the same as, I guess, going to a Liverpool match wearing an Everton scarf and not knowing. And not knowing is the part we need to be aware, and that is from self-exploration, going to our own counselling, speaking with our peers and having discussions like this, listening to the Counselling Tutor podcast, going to counsellingtutor.com, looking at the resources that we have there, joining the Facebook page and listening to other people and bringing your view across. This is all for you. That's why we do it.
Yeah, it's been a really interesting episode today. We started off with managing that anxiety during verbal skills assessment. I've talked about the importance of own personal therapy. And then we just finished on cultural dimensions in counselling, how our own culture may impact on the clients we work with. So that's all from us. And as always, stay grounded and stay safe.
Take the stress out of your counselling studies and get the support of Rory and I by joining us in the Counselling Study Resource. Counselling Study Resource, or CSR for short, is the world's most comprehensive assignment guidance and study support resource for students just like you of counselling and psychotherapy. See how Counselling Study Resource can help you. Visit counsellingtutor.com. That's counsellingtutor.com.
Thank you for listening to the Counselling Tutor Podcast. Find the show notes for this episode on our website at www.counsellingtutor.com.